very good morning to all our students, both from the King School and the Child Care. Well, this Wednesday morning, we have another health tip come your way, and it's a sequel of taking care of your ears. That is, ear care. Well, students, our ears are very, very delicate, and we need to look into taking care, most importantly, of them. Because of the online studies, that is, you have a lot of education that is happening online, it has been noticed that kids are hooked on to mobile sets and internet. Well, even hearing with your earphones could give rise to certain ear-related issues. Well, check out the slides ahead to understand in detail. So students, let us learn how do our ears get infected. A ear infection, also called as acute otitis media, is an infection of your middle ear. You see, children, the air-filled space behind the eardrum that contains tiny vibrating bones of your ear that helps you hear whatever has been said. Well, children are more likely than adults to get ear infection. This infection often results from other illnesses. Maybe you have a cold or some flu-like symptoms, or maybe allergies. It's what causes congestion and swelling of your nasal passages, your throat, and even your eustachian tube. Well, what is the role of your eustachian tubes? These are tubes that are like pair of narrow tubes that run from each middle ear to high in the back of your throat, behind the nasal passages. The throat end of the tubes open and close, and the function of these tubes are to regulate air pressure in the middle ear, refresh air in your ear, and to drain any normal secretions from your middle ear. Well, swollen eustachian tubes can become blocked, causing fluids to build up in your middle ear. This fluid can become infected and cause symptoms like ear infection. In children, the eustachian tubes are narrower and more horizontal, which makes it more difficult to drain and hence more likely to get clogged. Well then, what are the signs and symptoms common in children? These include ear pain, especially when you lie down, or tugging or pulling like sensation in your ear. Or maybe you may be having trouble sleeping, or your child is crying more often than usual, or having fussiness, having trouble hearing or responding to sounds, or fever of above 100 degrees of Fahrenheit. Or maybe you can feel some fluid coming out of your ear. You might also have symptoms like headache and loss of appetite. Students, you need to see a doctor when you have these signs and symptoms. Okay? Especially symptoms that last for more than a day. Your ear is paining for more than a day, or might be present in children that are less than 6 months of age. So if your ear pain is severe, you need to go and see a ear specialist doctor, and especially when you have any discharge from your ear. Okay? Now, when you constantly wear earphones and listen to music on a very loud volume, what happens, children? You simply damage your eardrums. The fact of the matter is that noise over above 90 decibels is bad for your ear. Earphones can damage your ears if they are used for long periods of time and at a higher volume, and can result in partial to complete hearing loss also. Okay? The damage could be permanent, as the sound from the earphones causes the hair cells in your inner ear, that is in the cochlea, to bend severely. Can earphones also damage your brain? Well, the electromagnetic waves that the headphones generate result in problems for the brain, if used over a long period of time. High decibel volumes withdraw insulation from your nerve fibers that carry signals from the ear to the brain. Okay, and are over ear headphones better than in the ear phones? Well, over the ear headphones are much better. Why? Because not only you do not have to worry about funneling sounds directly into your eardrums, but most over the ear headphones are also, as a general rule, more comfortable to use than earpieces. Well then, we need to be very careful about looking after our ears. Earbuds are used to clean your outer ears and not to clean your inner canal. Why so? It's because the wax that is accumulated over the sides and between your tube could get pushed onto your eardrum. And especially when you have a head bath, the shampoo from your hair could be used to clean your outer ear. You do not need to use anything else to clean your ears. Sometimes we do have an itchy sensation in our ears. Students, kindly refrain from using any sharp objects like your keys, your bob pins or some pins, or your pencils as well. Thank you very much, students. I'm sure these tips have helped you understand a little more detail why it is necessary for us to take care of our ears. Thank you.